I'm here with Dr. Barry Henry from the Lafayette Surgical Specialty Hospital. And tell me, we're at a football game. We hope there's never an injury, but sometimes it's just inevitable. What are some of the most common injuries you see?
Well, Blair, we see often hand injuries. When you're playing the ball, sometimes hit you on the end of the finger, sometimes you catch yourself when you hit the ground, or someone tackles you and the helmet crushes your wrist against your shoulder pads. Often we have injuries that people can go back in the game, but sometimes that's not the case. Even if people go back in the game, that injury needs to be further assessed. Sometimes athletic trainers can tape up or splint an injury. The player can finish the game, but it's very important when hand injuries to get a firm diagnosis. Sometimes we have fractures that are not properly diagnosed initially, but if with a good x-ray, clinical examination, we know exactly what we're dealing with, and we can get a good treatment plan to get the athlete back in action.
So you're saying proper diagnosis is key. If a football player gets hurt, they hurt their wrist, their hand, what should they do? What steps should they take?
Well, first of all, they need to inform their coach or medical staff on the team, get a good examination, be truthful with the athletic trainer about what they're feeling, and as soon as possible, get an x-ray of the injured extremity. We don't have those x-ray vision eyes as medical professionals, and once you have an x-ray, you know whether or not you're dealing with a fracture, a sprain, maybe it's a collateral ligament injury, maybe it's a tendon injury, or maybe it's something that you can't see right away, but with clinical follow-up, it'll reveal itself.
Okay. And lastly, just tell us where we can find you, Dr. Henry.
I'm here in Lafayette, Louisiana. I have an office across from the UL Athletic Complex, and I work at Lafayette Surgical Specialty Hospital to do my surgical cases. Very, very interested in getting athletes back in action. Sometimes that requires a little bit of therapy, a little bit of time, sometimes, unfortunately, surgery.
Okay. Thank you so much, Dr. Barry Henry. That does it for us down here. Back to you, Tammy.